Central Ohio hospitals are making some big changes to their visitation policies. For the time being, visitors will no longer be allowed. NBC4's Eric Halperin is in the newsroom. And Eric, in a way, this takes us back to the very beginning of the pandemic, doesn't it?
Colleen, back in March, Central Ohio's three major hospital groups put a policy like this in place. A couple months later, they eased some of the restrictions, but now they say as cases are higher than they've ever been, the policy is back for the safety of hospital patients and staff. The Ohio State University Wexner Medical Center, Mount Carmel, and Ohio Health announcing Tuesday they're bringing the no visitor policy back.
Basically, we're going back to the same visitation policy that we had this spring.
In a joint statement, the three hospital groups say the move is being made because of the increasing number of COVID-19 cases in the area.
And the numbers that we have as far as our positivity are clearly far worse than what they were in the spring. And being in alignment with the further alterations that are being out there by Governor DeWine, it makes sense to do as much as we can to protect patients and associates in the hospital from COVID-19.
Dr. Joseph Gastaldo is an infectious disease expert at Ohio Health. He says at their hospitals there have not been cases where a visitor has given COVID-19 to a patient or staff member.
That has not happened. However, there is that concern as more people come into the hospital.
According to Gastaldo, it's unclear at the moment how long the no visitor policy will be in effect for.
Really, what will determine when the restriction policy becomes less restrictive is that curve improving. And again, we don't know when that's going to happen, but looking forward, I really don't see our positivity rate changing until we get past the winter holidays.
This does not mean absolutely no visitors are allowed. There are exceptions for maternity, end-of-life situations, patients with impairments, and patients who are minors.
Limited visitation policies does make a significant negative impact on the patient experience. I am very sensitive to the emotional turmoil that patients do experience. And again, it's not an easy decision to make, but we have to prioritize patient safety.
And this policy goes into effect tomorrow. For visitors who are allowed under those exceptions, they can't have any COVID-19 symptoms or any recent exposures, and hospital-approved masks will also be required at all times. Jared?
Eric, thank you.